Tabligh Jamaat headquarters evacuated and sent to quarantine. Over 100 of the participants at the Tabligh congregation test positive, while 8 have died due to COVID-19. Delhi government files FIR against the organizers. Centre and states step up efforts to provide succour to underprivileged sections during the lockdown. Nationwide, more than 21,000 relief camps set up to house more than 6.5 lakh migrant workers, where they are being provided food and shelter. Number of active corona positive cases in the country stand at 1,238, while death toll goes up to 35. 123 persons have been discharged after recovery. Amid rising cases of novel coronavirus from different parts of the country, good news comes from Rajasthan. No new case reported in the last 24 hours, while 13 of the 26 corona cases have now fully recovered. And as countries world over grapple with coronavirus crisis, its intensity weakens and the worst hit Italy and Spain, while it intensifies in the US as death toll crosses 4,000. Donald Trump warns next 2 weeks are going to be very painful. Hello, you're watching DD News and I'm Preeti presenting the bulletin. Our top story first. The Tabligh Jamaat's Markaz in Nizamuddin West, which is among the major COVID-19 hotspots in the country, has been cleared after the evacuation of 2,361 people in the past 36 hours. Delhi Deputy Chief Minister Manish Sisodia informed in a tweet. Out of 2,361 in the building, 617 who had symptoms have been taken to hospitals, while others have been quarantined. The government launched a 36-hour-long operation to empty the markers and desanitize it later with the help of police, medical staff and municipal workers. The government has maintained that it is committed to identify, isolate and quarantine COVID-19 positive Tabligh Jamaat workers in India. Home Ministry released a statement yesterday over Tabligh Jamaat issue stating that on March 21st, the MHA was prompt to share details of Tabligh Jamaat workers, which included foreign nationals in India, further stating that this information was shared after COVID-19 positive cases surfaced in Telangana. Union Home Ministry acted swiftly on 21st of March itself, sharing details of foreign and Indian Tabligh Jamaat workers in India with all the states. The swift action was taken with a view to identify, isolate and quarantine Tabligh Jamaat workers who might be COVID-19 positive. Instructions were also issued by the MHA to Chief Secretaries and DGPs of all the states as well as the CP Delhi. The advisories were reiterated by the DIB to all state DGPs on March 28th and 29th. Meanwhile, workers staying in the Markaz in Nizamuddin were also screened. So far, 1,339 Tabligh Jamaat workers have been shifted to 3 quarantine facilities as well as to government hospitals in the capital as well as AIIMS, Jhajjar. Now, rest of them are currently being medically screened for COVID-19 infections. Delhi police has lodged an FIR against Maulana Saad and others for violating the government directives. Tabligh Jamaat Markaz is located in Nizamuddin in Delhi. Devout Muslims from across the country and also from foreign countries visit the Markaz for religious purpose. Some also move out in groups to different parts of the country for Tabligh activities. On March 21st, approximately 824 foreign Tabligh Jamaat workers were in different parts of the country for missionary work. Besides, around 216 foreign nationals were staying in the Markaz. And as the nation enters the 7th day of the lockdown, the active cases of COVID-19 has reached 1,466. 132 people have been cured from the disease, while 38 have succumbed to the coronavirus infection. Ministry of Health is working in close coordination with states in tracing the contacts of the coronavirus patients in the country. A high-level meeting of the group of ministers on COVID-19 was chaired by Union Health Minister Dr. Harshvardhan in Delhi. Minister of External Affairs Dr. S. Jaishankar, Minister of Civil Aviation Hardeep Singh Puri, Minister of State for Home Nityanand Rai, besides other ministers and officials were present at the meeting. The group of ministers reviewed current status, action taken and preparedness of the states and union territories for management of COVID-19. The group of ministers also discussed the need for each state to set up exclusive hospitals for COVID-19 patients. A Science and Technology Empowered Committee for COVID-19 response has been constituted, chaired by Professor Vinod Paul, member Niti Aayog and Principal Scientific Advisor to the Government of India, to coordinate amongst science agencies, scientists, industries and regulatory bodies. The committee will work with Department of Science and Technology, Department of Biotechnology, Council of Scientific and Industrial Research, Defence Research and Development Organization and the Indian Institute of Science to take speedy decisions on research and development, keeping in view the critical need to increase the testing facilities for COVID-19 disease. The union government has reiterated that strict action will be taken against landlords who threaten to throw out the nurses, doctors or healthcare professionals. Joint Secretary of Home Affairs Punya Salila Srivastav said that there is no shortage of essential commodities while more than 6 lakh migrant workers have been provided shelter.
लॉकडाउन का एनफोर्समेंट स्टेट्स और यूटीज़ में संतोषजनक रूप से चल रहा है। एसेंशियल सप्लाईज की स्थिति भी संतोषजनक है। जो हमें राज्य सरकारों और यूटी से जानकारी प्राप्त हुई है उसके अनुसार लगभग स्टेट्स और यूटीज़ में लगभग 21,064 माइग्रेंट रिलीफ कैंप्स सेटअप किए गए हैं और इन रिलीफ कैंप्स में लगभग 6 लाख से अधिक, अगर मैं एग्जैक्ट फिगर कोट करूं तो 6,66,291 लोगों को शेल्टर की सुविधा दी गई है। इसके अलावा लगभग 23 लाख लोगों को भोजन की भी सुविधा प्रदान की गई है।
Although COVID-19 cases have grown faster over the last 1 week, the transmission rate in India has lowered than elsewhere, experts note. Now, comparison of the growth in cases, deaths between India and other countries. We flash it on your screens. The rates in India remains significantly lower than that of the global rate. On March 19, every positive case in India was transmitting the virus to 1.7 people on average. By March 26, that number had also risen to 1.81. but remained significantly lower than countries such as Iran or Italy, according to the Institute of Mathematical Sciences in Chennai, scientist Sita Bhadrasinha. For comparison, a study in The Lancet estimates the global transmission rate of COVID-19, the number of persons infected by every positive case, to be between 2 and 3. In India, despite overall rise in numbers, this rate remains significantly low at 1.8. And Karnataka government has launched a quarantine watch app. The app is for the quarantine patients who must send selfies to government on an hourly basis for monitoring their health status. The pictures sent on the app will be strictly protected and will be used by doctors only.
With the implementation of strict lockdown advisory in Bangalore, the city which was once known as Pensioners' Paradise and Garden City, the chirping of birds can be heard clearly here. But the government is maintaining strict vigilance on those who are quarantined. Unfortunately, the saga of those who attended the Tablighi Jamaat congregation at Delhi also links with South India and has reached Bangalore also. Over 53 people from Karnataka attended this congregation, and Karnataka government has been able to track 13 people who were part of this Tablighi Jamaat congregation, and they have been quarantined medically. Now the government has come up with strict advisory and warned those who have been medically quarantined and are home quarantined, they should send hourly selfie to the government, because this selfie is monitored by the government medically, since it has coordinates of the patients who are staying in their homes, and the government can monitor them on hourly basis. And the government has warned that those who do not send their selfie on hourly basis will be sent to mass quarantines. So the government is taking strict measures to monitor the quarantine people medically. And on the other hand, Karnataka government has also asked the doctors and medical students to register and offer services in the time of crisis. Many students and doctors are registering to come forward and help and counsel people not only fight coronavirus but also help people dispel their fears about common cold and fever as well. The government is implementing strict measures across the state and says that people who do not follow the strict advisory given by the government will be sent to mass quarantines. And the government has already warned that if the state does not follow the lockdown measures strictly, the government will not hesitate to extend the lockdown in the state. Aisha Khanam, Bangalore, DD India.
The nationwide lockdown to curb COVID-19 spread seems to be working well, as Rajasthan did not report a single positive case in the last 24 hours. Now, Rajasthan has 76 active COVID-19 positive cases, including 2 Italian nationals. 17 Indian evacuees from Iran have also tested positive so far. The total positive cases in Rajasthan stand at 93, with 76 active cases. And our correspondent Vishal Baristo files a report on the latest situation from Jaipur.
The street behind me connects us to the road that takes us straight to the walled city. The walled city, which was constructed by Savai Jai Singh in the 18th century to protect Jaipur from outside attack. And today, the city administration has locked and sealed that walled city. The reason, to protect the city from the spread of coronavirus. No vehicle is allowed inside or outside the walled city. Even essential commodities like milk, fruits and vegetables would be taken to the walled city, and from there on the city vehicles would not be allowed, but the administration vehicles would take it to the people. SDRF team have been deployed there to protect and prevent any eventuality. With cameraman Anugrah in Jaipur, this is Vishal Baristo, DD India.
25 women auto drivers in Thane are serving those who want to reach hospital due to medical emergency. Now, these women auto drivers help pregnant women, dialysis patients and elderly patients to reach hospitals, and also offer these services free of cost to women. With the approval of the district magistrate, a helpline number has been issued by Thane RTO for rickshaw on demand in Thane city. Now, the helpline number is 9967 312176. I repeat, 9967 312176. Now, this service is available between 10 a.m. and 5 p.m. daily.
कोरोना वायरस का संकट पूरे महाराष्ट्र पे या पूरे देश पे आया है, और ये इसमें रुग्ण जो इमरजेंसी है, जिसमें डायलिसिस करने जाना है, जिसको ब्लड चेक करने जाना है, जिसका रूटीन चेकअप है, इसलिए हमने हमारे पालक मंत्री एकनाथ शिंदे साहब और लोंडे साहब और सूर्य मामा के इनके माध्यम से इनके समझने से हमने एक व्हाट्सएप ग्रुप तैयार किया है, और ये व्हाट्सएप ग्रुप पे हमको मैसेज आता है, वैसे हम लोग रुग्ण के पास जाते हैं, उनको हॉस्पिटल पहुंच जाते हैं.
Police personnel are the ones who are ensuring that the lockdown is properly followed. Mumbai police, along with traffic police, are carrying out checkings across the city to ensure only those involved in essential services are on the roads. Now, those found loitering unnecessarily are booked.
To ensure that the lockdown is implemented in a very proper manner, these policemen, these police personnel are working day in and day out to ensure that no people other than those who are involved in essential services are out. You can see how they are doing the checking of the iCards, and these are the two-wheelers, and that side, if you can see, that side are the four-wheelers where these police personnel from the Chunabhatti police station near Suman Nagar, they are doing the checking. These people are all equipped with the personal hygienic equipments, that is the mask, and some of them are wearing gloves as well. They also have their sanitizers with them. Time and again, they're telling people that if you're not on any essential services job, do not come out. And those who are found that they are not in those essential services job, they are being asked to come aside and investigation. ये बताइए सर, किस तरीके से ये पूरा इंश्योर किया जा रहा है कि कोई जो अत्यावश्यक सेवा में नहीं है वो निर्णय निकले?
हाँ, अत्यावश्यक जो सेवा है वो तो चालू है, लेकिन जो टेम्पो के अंदर आदमी लोग बेकायदे से निकल जाते हैं, वो चेकिंग करने का, और अब दूसरा कुछ भी चीज़ नहीं जाना चाहिए.
और जो नहीं है अत्यावश्यक सेवा में, उनके साथ में क्या किया जा रहा है?
उसको कार्रवाई किया जाता है, मिलेगा तो उसके ऊपर कार्रवाई कानून के तौर से तो कार्रवाई किया जाता है.
और अपने पर्सनल हाइजीनिक जितने भी सोशल डिस्टेंसिंग है या मास्क है, उसके लिए आप लोग ने अपना क्या किया लिया है?
हमने सबके लिए सबके मास्क है, सैनिटाइजर है, यूज है, ऐसा कुछ नहीं है।
So they have ensured that they themselves are properly equipped with all the necessary hygienic and the personal hygienic equipments, that is the mask and also the gloves that they are wearing. Also, while checking these people, they are ensuring that the social distance is maintained with these people and they themselves are not at any risk. With camera person Iqbal, this is Shama Mishra for DD News, Mumbai.
In West Bengal, people of transgender community have come forward to help the needy in the city of Joy, that is Kolkata. They distributed rice, dal, potatoes and other essential food items among the poor and needy in their locality. They wore masks and exercised social distancing while distributing food items. In Tamil Nadu too, people of transgender community distributed food packets to the poor and needy in Chennai. And Gurdwaras may be seeing fewer devotees due to the lockdown, but their age-old tradition of offering langar services to the poor and homeless at the times of crisis are being followed religiously. One such Gurdwara in Amritsar is serving food round the clock to feed the poor, including labourers and stranded people due to the lockdown. The Gurdwara offers langar to around 10 to 12,000 people on a daily basis while maintaining preventive measures like sanitation, hygiene and social distancing. People serving food also wear masks and gloves to avoid any social contact. India today welcomed the announcement by the government of Afghanistan about formation of a team for intra-Afghan negotiations. Afghan President Ashraf Ghani formed the team weeks after signing the peace agreement. India called the formation of the team as a positive step which would lead to a peaceful and stable future for Afghanistan, free from externally sponsored terrorism. India also called upon all sections of the political spectrum in Afghanistan to work together to meet the aspirations of all people in that country, including those from the minority community, for a prosperous and a safe future. And more than 40,000 people have been killed in coronavirus pandemic as the disease barrels across the globe, with the US bracing for its darkest hours after its death toll surpassed China's on Tuesday. US President Donald Trump warned Americans that they would have a very tough 2 weeks coming in the fight against coronavirus. During a news conference at the White House, Trump urged everyone to follow federal social distancing guidelines through the end of April. He said that the next 2 weeks would be very painful. More than 4,000 people have died from COVID-19 in the United States.
It's absolutely critical for the American people to follow the guidelines for the next 30 days. It's a matter of life and death, frankly. It's a matter of life and death. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
Our correspondent Jagriti Dave files this report from US.
On Sunday, the coronavirus task force gave a briefing at the White House, and there President Trump announced that the social distancing guidelines in the United States would be extended until April the 30th. And this is a huge difference from the dates that President Trump had previously suggested. He had said that the economy could possibly reopen by Easter, but that is clearly not going to be the case. He accepted figures put forward by a member of the coronavirus task force, Dr. Anthony Fauci, one of the US's top experts on infectious diseases. And Dr. Fauci had given a television interview earlier on Sunday where he had said that between 100,000 to 200,000 Americans could die of the coronavirus. President Trump at this briefing acknowledged those figures, but he also said that the figure could be higher, that citing a study saying that 2.2 million Americans could possibly die of the coronavirus if the government did nothing to mitigate the spread. And so clearly these figures have factored into the decision to extend the social distancing guidelines to the end of April. President Trump did say, however, that the United States could be well on the way to recovery by June the 1st. But he did say that he didn't foresee relaxing the guidelines anywhere in the United States before the end of April.
And deaths shot up again across Europe on Tuesday as Spain, France and Britain reported their deadliest days. While there are hopeful signs that the spread of the infection is slowing in the hardest hit Italy and Spain, more than 8,000 died overnight in both the countries. France joined it with a surge to 3,525 deaths. An official toll that includes only those who died in hospitals and not those who died at home or in old people's homes. The inundation of patients has sent health facilities around the world into overdrive. Field hospitals are popping up in event spaces while distressed medical staff make grim decisions about how to distribute limited protective gear, beds and life-saving respirators. In scenes previously unimaginable in peacetime, around a dozen white tents were erected to serve as field hospital in New York's Central Park. Indian opening batswoman and T20 international vice-captain Smriti Mandhana, who is currently at home quarantine, posted a video on her Twitter account appealing to people to stay home. Mandhana writes, "It can be hard spending so many days at home, but this is what we need to do to stay safe. And to ensure that you pay safe as well, remember that payment karne ke liye UPI chalega." Mandhana has been asked by her hometown's health officer to stay in home quarantine as a precautionary measure.
अब हर दुकान पे यूपीआई चलेगा। अगर कुछ सवाल हो, UPI-chalega.com से जान।
आपने सुना मिसेस राव ने क्या कहा? लॉकडाउन चल रहा है और सबको पता है सोशल डिस्टेंसिंग कितना इम्पोर्टेंट है। मोबाइल है ना, तो इसे सही यूज करो। जो भी खर्चा हो उसे डिजिटली पे करो यूपीआई से। सिंपल है, हर चीज हर जगह के लिए यूपीआई चलेगा। आप समझ गए ना? तो आप सेफ रहो और याद रखो, हर एक्सपेंस के लिए सिर्फ यूपीआई चलेगा।
Yes, keep yourself safe, stay indoors. And that's it in this edition of the News this hour. But we leave you with these video messages coming in from our young Corona warriors. Take a look. Bye-bye.
नमस्ते, जनता से निवेदन है ताकि आप अपने घर में रहें और मोदी जी की बात सुने ताकि हम कोरोना वायरस से बच सके। Hello friends, my name is Siana. Please stay at home and wash your hands frequently. Do your bit and fight against COVID-19 and save our Mother Earth. Thank you. बार-बार अपने हाथों को साबुन से अच्छे से धोएं। अपने गंदे हाथ चेहरे पर ना लगाएं। खांसते या छींकते समय रुमाल का इस्तेमाल करना चाहिए। दूसरा, समय समय पर हाथ धोने या सैनिटाइज का उपयोग करना चाहिए।
All right, that's it in this edition of News this hour. Thanks for watching. Bye-bye.